Hi folks, a few questions, starting with the first one from Mrs. M. Hi there, just read a new book. It's No Accident regarding pee poop accidents, and I feel like the book was written for my child. Have you guys read it? Do you implement x-rays and clean out regimens for constipation diagnosis and treatment? I'm familiar with the book. I perused it, but I have not read it. I think the gist of the book is that some children are late potty trainers and some children have accidents, especially at night, and some during the day. And in some children, it can be related to their being constipated and have a lot of poop in their belly and putting pressure on their bladder and causing them to have a pee accident. So you assume it's a problem with urination, but it's really a problem with poop retention, causing pressure in the belly, causing urinary problems. And yes, we commonly do an abdominal x-ray just to make sure there isn't a lot of poop in there. And we do have a clean out system, just a transient thing, but it's more of to get the kids on the right road of eating right and pooping consistently. So I hope that answers your question. Next question. Hi, I was in your office for my son who cut his finger. You said it did not need stitches or glue. I took him to an urgent care later in the day because I was worried, and they told me it could go either way, stitches or no stitches. But I told them I would feel better with stitches. So they did it, and it cost me $400. Do you really think he needed stitches? No, that's why I said I don't think he needs stitches. I think if you go to an urgent care and they actually tell you he probably needs them or he probably doesn't need them, it sounds like he doesn't need them. Now, how will his getting stitches help him if he really doesn't need them? Well, if you go to an urgent care and they have the option of doing a procedure and generating an income based on what you want as a mother, then they'll probably do the stitches, especially if it'll make you feel better. But I would stand by what I had told you in that when I had seen your child, he didn't need stitches and he didn't need glue. So I think that's just what I told you, so I'm just going to stick with that. Next question. I brush my 2-year-old's children. I brush my 2-year-old child's teeth with my toothbrush to help her learn how to brush her teeth. Is that okay? I think that's great that you're brushing her teeth and showing her how to brush her teeth. I don't think it's a good idea for you to use your toothbrush in her mouth because kids aren't born with a lot of bacteria in their mouths. In fact, the bacteria that cause cavities, they grow over a year, 2 years, about 3 years of age. They actually have the bacteria in their mouths to have cavities. So it takes them a while just to actually colonize enough bacteria in their mouths for them to have cavities. Now, we as adults already have these bacteria in our mouth. They just live there. That's why we brush and try and keep our teeth clean. So by brushing our teeth and then brushing our children's teeth, we're kind of translocating the bacteria, the cavity-causing bacteria, from our mouths to their mouths earlier in their lives than they would have been exposed to it. Now, is it a big deal? No, but I don't think you should continue doing it. But as a general rule, it's probably better to have separate toothbrushes. Anyway, that's it. So thanks very much for the questions, and have a great week.